morning. I'm going to do an attentive spirometry, so I'm going to use a volumetric exerciser. So the first thing I'm going to do is check the patient's charts, and I'm going to look to see if they had any pain medications, any treatments like nebulizer treatments to keep their lungs secretions loose, so that way I can take them and give them this treatment to help them strengthen their lungs to cough it up. So when I get to the patient's room, I always knock on the patient's room, introduce myself, and then I will check the patient ID band, wash my hands, and then when I'm ready, I will apply the appropriate PPE before I assess the patient. So I'd listen to the patient's lungs, and then I would check the vital signs before, and then I'd explain to the patient what I'm going to be doing, have them do. So today here I have a volumetric exerciser. So this is just to help you basically widen up your lungs more, kind of strengthen them to open them up and loosen up those secretions and get you to be able to cough up anything. And this will help you prevent any further complications such as atelectasis. You don't want to have any of those, and also will help prevent some secretions from staying built up in the lungs. So here with the volumetric exerciser, everyone comes with a chart. So I'm going to use me as examples. So it will give you a chart for like the age and height. And so I'm going to be between 1900 and 1850, around there. And so I'm going to go ahead and prepare my machine. And so before you have the patient do this, you'll have them sit up. You'll have them sit up in the bed if they possibly can, as much. And if they just got done with surgery and they feel very uncomfortable, you can have them put a pillow in front of them to keep them comfortable. You don't want them to feel overwhelmed with it. So when I'm ready, I will have them, I can have a table sitting there, and I can have this sitting like this for them. And then I would connect this, make sure it's tight. And then I would make sure this is all set up to where it needs to be for the patient. And then when I'm ready, I will demonstrate for them. That way they understand how to properly do it, and that way they get the best results. All right, so the first thing I'm gonna have you do is inhale, and then I'm gonna have you exhale, feel like you have all the air out of your lungs. And then when you're ready to inhale again, I want you to put your mouth on this. I want your tongue to go underneath the mouthpiece, and I want you to have a tight seal around it. So when you inhale, I want you to inhale as good as you can and hold it for 3 to 5 seconds, okay, if you can. If you can't quite hold that 3 to 5 seconds, that's okay. We'll just continue to practice and get your lung strength up, okay? So when I'm ready, I'll demonstrate for them. So we're gonna have it sitting like this, and then we're gonna have them take a nice deep breath in, then exhale. So we need to be able to see where the piston here goes up. And then if they can't quite get to where they need to be, like based off of the chart reading, we can just set a goal for them, and we can start it at a lower goal. That way they can practice doing that. And we instruct the patient to try to do it 6 to 10 times. But if they are unable to, that's okay. We can just work up to it, and we don't want to overwhelm them, and we don't want them to do it too many times after on another, because we don't want them to hyperventilate when they do this. And so then we will set this next to their bedside, and they can continue to practice it. But what we'll do is we'll remove this, and then you can set the patient's name on the bottom and their room number and the date that I gave them the machine. That way they know what's theirs, and they can use it for further use. They can take it home with them if they need to. So you can take off the mouthpiece and this, and you can wash it in sterile water and dry it if they are done using it for a little while. And then you can just set it off to the side. But if you're just setting it off to the side, just let it air dry. And we'll set it close to their bedside if they are feeling they're able to do a few more practices within that hour. So when I am all finished, I will examine the patient, make sure they're doing okay. I will check their lung sounds, have them always cough after they do a breathing treatment like this. And then I will make sure their vital signs look good. Then I would remove my PPE. And then I would wash my hands, and then I would go and chart on the patient's chart what I did for the patient.